I want to welcome everyone on the call to our RAMS webinar of four-letter words, STEPs, VSLOE, the SLOE, ERAS, and the EM application cycle. Welcome everyone. My name is Juana Espinoza Vasquez. I'm the RAMS board liaison from SAEM, and then I'll let everybody else here, our panelists and moderators, introduce themselves.
Hey everyone, I'm Patricia Hernandez. I'm a resident. I serve as a member at large on the RAMS board. Really excited to be here today with Mitchell. Mitchell, do you want to introduce yourself?
Sure. Hey everyone, I'm also a resident. I'm a PGY4. My name is Mitchell, and I am the Secretary Treasurer of the RAMS board.
And we're really excited for this panel today and grateful for our panelists for taking the time and for you all. Hopefully you have some good information and you guys can have a space to have some questions for this upcoming period. That's a really important time. So if there's any question, you can put it in the chat along the way and we'll definitely have some time in the end, hopefully. But without further ado, just want to briefly introduce our three panelists, Dr. Sakan, Dr. House, and Dr. Tillman. And each of you, if you could just briefly give us where you're from and anything else you want to share before we jump into the slides.
Hi guys, my name's Navdeep Sikhan. I'm the clerkship director over here at Baylor. I've been a clerkship director since 2016 and have been advising medical students since 2012. So I'm excited to talk to you about this topic, which is somewhat important to you all.
I'm Joe House. I am the clerkship director at the University of Michigan. I'm also the president for CDEM, which is Clerkship Directors of Emergency Medicine, so the national groups. I have been clerkship director, I think I'm going on 12 years now, maybe a little longer than that. So for a while.
Hi, everybody. I'm Dave Tillman. I'm clerkship director here at the University of Wisconsin. I'm about to go on shift, so I might leave a couple minutes early. But I think 2016 was my first year too, Nav. So it's been a while, although you guys are obviously getting old and I'm staying very young.
I'd say Dr. Sekhorn was actually one of my, you were an intern when I was a senior? Is that what it was?
Yes, you're a very intimidating senior resident.
Thank you. I try. No, you were. So I think we're going to start out with Dr. Sekhorn going through some slides with some of the big topics that kind of the goal of presenting this.
So we're talking about navigating the EM application journey. It's a fun journey full of excitements and there are many paths. Fortunately, they usually end up in matching. So that's sort of good. Anyways, moving on, let's start out for step one is the first part of the path. And to be honest, not a big deal anymore. Back in the old days, it was a huge deal. Now it's pass fail, got past step one. That's how it is. Now, moving on to step two, this is an important thing. We can talk about Doctors House and Tillman about it, but usually to have a competitive application, you need to have a step two score in before your ERAS application is uploaded. Doctors House, Tillman, do you guys agree with that statement?
Yeah, absolutely.
And in terms of the scores, this is from the 20 match data. And basically it shows the average score of step 2 CK for somebody who matched was 247. But to be honest, you can see even people who have lower scores, they still tend to match. So most programs nowadays aren't as reliant as step scores as they were before, especially more competitive programs. They're more reliant on looking at a holistic view of your application. Doctors House and Tillman, any comment you want to make regarding step two?
Yeah, I would just say that the data is preliminary, but it suggests that doing well on step one and studying hard for step one probably sets you up for success on step two. Those kind of study skills, you'll know whether or not the prep time that you had and the preparation plan that you had was adequate or inadequate for you. So if you're naturally lazy like me and you want to just kind of mail it in, you might be in a rough spot when it comes to step two.
That's a great point. You should definitely take step one seriously. In terms of VSLO, this is another thing that you guys are probably approaching in the next couple months. It's something that's pretty important. I know Dr. Tillman has an opinion on it, which is somewhat interesting, but in general, you want to do one home and one away for most applicants. The key thing for VSLO, get your ducks in a row. Make sure that when you apply, your vaccinations are up to date. A lot of times they'll need varicella titers and other prereqs. And also for a lot of the more competitive programs, the spots fill up pretty quickly. So try to apply as soon as the application opens. It's often asked, what are good ways to find programs? There is the EMRA Match website, which is pretty good, as well as the SAM Clerkship Directory. These are probably the two best ways to find programs to get your SLOEs. But remember, some SLOEs are outside of VSATs. So programs that you find, you may want to look at their website. Doctors House and Tillman, anything else you guys want to bring up?
I would say definitely take a look at stuff ahead of time because, there's some programs that even want a letter from your school saying you're in good standing, a letter from your clerkship director and say, yes, you're interested in emergency medicine. So that's kind of what I've talked to my students at this point is take a look at it now because, again, some programs have a rolling acceptance. Other places have a deadline and have your stuff in by March 1st. I haven't seen any data, so this is more my opinion maybe. But I think if you're in that first group of programs, when they look at the applications, your chances of acceptance go up. Once we fill those spots, like Dr. Sekhorn mentioned, they're filled. So I think the sooner you can get your stuff in, so that way if I open open it up on May 1st, your stuff's already in there versus submitting stuff in June or July, which I may not look at because I may have already filled my spots.
What I usually tell my students is there are probably 3 common reasons to choose a specific away to apply to. And the most common one being, I have free housing in this place. And that's totally a legitimate reason to go someplace. It's an expensive endeavor for you, on average between $1,000 and $1,500 per away rotation, so that's worthwhile. The next most common reason is explore a different type of program. This program is attached to a hospital that has a county mission, or it has a academic style, or is a more community style hospital. And the last one is commonly to explore a specific program for you to spend a month advertising yourself to them.
And someone in the chat kind of threw in questions about scholarships and stipends. Again, I think that's a reason to look at it ahead of time at different programs. A lot of programs will have scholarships or funding available, especially for underrepresented individuals. So I think take a look at that, see what's available. I've heard of some programs offering places to stay versus potentially staying with resident things. So I think kind of looking at that, because like I know for us at Michigan, like if you're interested in the DEI scholarship, it is a separate application after getting accepted. So again, kind of knowing all that stuff ahead of time.
Perfect. And then here's a question I'll pose to the team. How many programs do you guys think that an average student should apply to for a 1-month block? I know there's some variation on this, but there's some data.
That's a pretty good guess, Paige. Previous data would have suggested that 4 to 5 was where you need to do, but that data is probably pre-COVID and pre the restriction down to 1 away rotation. So on average, there's probably more away rotations than there are students. So places as far as across the country, they're not filling all the way, which is good. Good for you guys.
Yeah, I'm still telling my students to look at maybe 3 to 5 programs or 3 to 5 applications, but knowing that my students last year, most of them were declining offers because, like Dr. Tillman mentioned, now there's a lot of programs that aren't filling. Now that being said, there's not a true restriction. We do ask, or at least I tell my students, like, you don't really need to do more than 1 away rotation. Now there are a few exceptions, and we do try to individualize advising for the individual student, but I have seen applications where people are 2 and 3 still, or going back to doing more and more, which doesn't necessarily better per se, but yeah, I tell our students 3 to 5 programs.
I agree with exactly what Dr. House Tillman said. I'm a little bit more risk averse, so I say 4 to 5, but that's because I'm a very conservative fellow. But I think Dr. House mentioned an important topic, which is certain students, most students, 95% is 1 home, 1 away. But there's some situations where you may consider doing 2 aways, and that's if you have a red flag on your application, or if you're couples matching. Those are situations where the match may be a little bit more challenging, and you may consider doing 2 aways. Drs. House and Tillman, you guys have any comments on that?
I'd add in that if you're a program that doesn't have a home SLOE to give you, or a home SLOE to give you, you'll do 2 aways, but that's totally fine. You need 2 SLOEs.
Some of the military ones, you're participation at a military site. So again, that may be one where you do, maybe 1 at home, do 1 military site, and then maybe still do a 3rd one. What I often tell my students is plan on doing the 2. Let's see how your first one goes, because definitely, especially in the current environment, say you do your first rotation in our department and you get a pass, it doesn't exclude you from going into EM. I know some other specialty, like, hey, you've got to honor all of them, or you're not going to have. But that might be one where I tell my students, what, do that for, you got that pass with us, that's fine. Let's see how you do in the next one. If you get a high pass, okay, maybe consider doing a 3rd one, so you show that you're learning, that you're progressing. But if you get an honors with us and an honors with your away rotation, again, that value in that 3rd one, there may not be a whole lot of value. Now, I can't remember. I know I looked at your slides. I don't remember if you kind of bring this up. I mean, one thing that I do talk my students to consider is other non-kind of core EM rotations. Think about ultrasound rotations at other sites. Think about toxicology rotations at other sites. So there are ways, because I know that's one of the concerns, especially with the virtual rotations or the virtual interviews, is getting to know the site, getting to know the residents, getting to know the kind of culture at different residencies. So sometimes doing these other ultrasound, toxicology, research rotations, it does get you an idea, or get a chance to kind of meet people, talk with people, get an idea of the environment, even within the setting of the virtual. So again, there are other ways of going to places that is not that typical rotation.
And then a second question that I've often heard from students tell me is like, hey, should I do an away where I want to do residency? I have my opinion on it, but I'm also curious here, Dr. Tillman and House.
My opinion is this is something that for you students, I'm not sure what you're like individually, but it requires self-reflection. You need to know what you're good at, what your skills are, how you're going to show on your away rotation. If you're the kind of person who is going to struggle being maximally on for an entire month, then maybe having your audition rotation at a place that is like your desired residency location is not such a great idea. But for the average EM applicant, it ends up being a good thing. You get to know the program, they get to know you. You get to show that you are a hard worker and easy to teach and courteous to nurses and patients, etc.
Yeah, and I feel very similar. I kind of tell students, it's a little bit of a gamble. You're betting on yourself. We have had students who have done away rotations at Michigan. We may or may not have had people say, if that person matches here, I'm leaving. But we've also had students who, if you look at them purely on paper, may not have been offered an interview. Everybody loved him and everybody wanted him here and was one of the top ranks in their program. So again, I think it's like Dr. Tillman mentioned, it's self-reflective because like I said, it's a month-long interview.
I agree with Drs. House and Tillman. The self-reflection is important. If you're clinically strong, you play nice with others in the sandbox, you want to go there, it's probably a good idea. The way that I say this is probably because I'm Indian. It's the match is like an arranged marriage, right? You don't see each other really. You date once or twice on an hour-on interview, and then you get married. While doing your away rotation there is sort of like dating for a month and getting to know each other. But that's just my little spiel. Anyways, now for VSLO in the past, some students have written, let's ask faculty to send letters of interest or letters of support for an application to a visiting VSLO spot. Drs. House and Tillman, do you guys have any thoughts on that?
Yeah, 2 letters, 2 SLOE letters for sure.
You're referring to the away rotation, right? I've said sometimes I've had programs say they needed a letter of support. I will say, maybe Dr. Tillman talked about being lazy earlier. Maybe I'm lazy as well. I just usually tell students, if they want one, great, we'll write one. If they don't ask for one, I'm not sure if it helps get a spot, especially with the number of spots that seem to be available currently.
And I agree with Dr. House. To be honest, unless I know the clerk director or the faculty are writing a letter for me, the letters really don't sway me one way or the other. It's usually the way that I look at it. Now to the important thing, our friend ERAS. Just keep in mind, in general, your goal is probably to get between 12 to 14 interviews. The 2022 match data showed that average numbers of ranks for a match candidate is 15. And the question students often have is, how many places should I apply to? The key thing is this is where you need a good mentor. A mentor has been in the game for a long time and can honestly assess your application and see how competitive you are. This is based on the old data. In general, the average applicant between 30 to 40 is what I've historically recommended. I was wondering, Drs. House and Tillman, what do you guys think? How many places the average applicant should apply to?
It would probably end up being around there, recognizing that, like, let's say there's an all-star applicant like Patricia 3 years ago or whatever. We could, even her being awesome, we could create a list of programs that she would apply to where her interview rate per program is somewhere less than 25. So for even an all-star person, if we're applying to only the 30 most competitive programs, you're going to be coin flipping at best at all these programs. So so the number isn't nearly as important as the blend or like which specific programs you apply to, or whether you're having advice about your strengths and weaknesses and therefore having a nuanced and individualized application.
So what Dr. Tillman's kind of mentioning a little bit is, again, there's not because I've had students go and it's like, oh, is there a spot where I can see how programs are ranked? Which is a competitive program, which is maybe a less competitive program, which is one in the middle. And there's not really a spot out there that can really provide that data. So that's why, again, having that mentor, and for students who maybe are at a site that do not have a home clerkship, or don't have a residency, have concerns about mentorship, there's definitely things available. And I think that has some links later on about where you can go. If not, we can add them to the chat. So there are ways of get some of that mentorship even remotely. So the goal being 12 to 14. And again, that's kind of think about programs that are ranked. So these are places that you want to go to. So if you've got 15 interviews, then you probably should be ranking all 15 of those programs to kind of get to that. Where if you're like me, there were definitely a couple of programs, even after the dinner the night before, I second guessed, like, do I even want to go for that interview? So again, there may be programs where you could go to that you're like, this is not really a fit for me. This is not what I'm looking for. So again, these are thinking of ranking the 15 or so programs, but definitely you want that mix. So again, if you are a top tier student, you may have more of the quote unquote competitive program. So maybe 50-50 competitive and middle competitive programs, where if you're a average student, then maybe you're looking at a third, or having kind of that mixture. So even like my top students, I tell them that they need to not just be applying for the top programs, but again, still have that mixture between the competitive programs and some of the lower competitive programs. So yeah, you want to mentor, like you said, is going to be honest feedback. Hey, you're going to be a student who struggles. You may need 40 to 50 programs. Hey, you're couples matching. Again, you might need 50 programs. Hey, you're a rock star. Maybe you only need 20 programs to apply for, but you need to mix it up and have a 15 competitive, 5 less, that sort of thing. So it really does matter, or it really is individualized. And I even tell my students, don't talk for each other, because just because I'm telling you, you need to apply to 30 programs and you need to apply to 50 programs, it doesn't mean I think you're a stronger student than the other. Sometimes it's just what you're looking for. I mean, if you're looking to stay in the Midwest, just in general, Midwest is less competitive. You're going to need to look at less programs. Or if you're saying I need to go West Coast, the Southwest, maybe you need to look at a few more programs, again, just because of the location sort of thing.
Cool. And this is just showing like match versus not matches in 2022 match match data. And you can see over here that most people did way more than 15 in terms of their rank list. But to be honest, look down, the one person who didn't match had 8 as a rank. I think most people don't feel super like confident and only ranking 8. I think my personal opinion is like between 12 to 14 is a good number. 15 is like being very safe. But you can see like if you get a lot of interviews, you'll be pretty safe. And a rank list from around here is a pretty safe number for a rank list. But most people recommend between 12 to 14 based on historic data. And this just goes to the probability of matching based on the size of your rank list. And you can see you're approaching 90% around like 10. And then you go to 12 to 14, you get closer to 100%. So this is a good slide. Sorry, go ahead, Dr. Tillman.
I would just love for all students across the country, if I can control this, to have it not get to the point of having to not rank places if they have too many. I would just love you to not even go on those interviews. If you have 16, 17 interviews scheduled, start canceling some, start being courteous to your colleagues who are looking to get those interviews, which are a pretty limited resource. That'd be pretty cool, but that's my pie in the sky philosophy.
Yeah, I'd say I start talking to my students once they're getting up to that 20 range to start thinking about canceling interviews. Because that's the other thing is you get excited for them at the beginning. And then again, this was me after the first 10 or so. I'm like, okay, when are these done? But that was also the time we traveled. So I have heard of students doing like 3 interviews in one day, which I think is crazy. But
yeah, I agree with Doctors House and Tillman. Please be courteous to yourself, your interviewers. Please limit, and your colleagues, please try to limit the number of interviews you go on. Anything more than 15, 16 is probably just not the most fruitful. In terms of ERAS, people always talk about their CV and how well-rounded of an application you should have. And people say, I'm weak on volunteer work. Should I do some more service work in the last few months? To be honest, this comes to the thing of quality versus quantity. To be honest, I would always tell students to do what you're passionate about because that's what you're going to excel at. And that will shine through your application. When review applications, we see a lot of like one-offs, and that really doesn't add much to your application. So I would focus on quality and stuff you're passionate about then rather than just choosing like stuff to round out your application. Doctors House and Tillman, you guys have any comments on that?
The way that I always tell my students is that you're trying to create a narrative. You want to tell your story about who you are, what's important to you, why you're going to be successful in residency, why you're going to be successful in this place. Experiences that you try to get during medical school should contribute to the narrative you're trying to build. What is important to you? What are you passionate about? It all comes down to that. So that narrative should come across in your CV, in your most important experiences, and in your letter.
And this slide over here just sort of illustrates that point. You see like this number of research experiences comparing those who are matched versus not matched, as well as the number of publications / abstracts. And then you can see over here, especially the number of abstract publications. Look, 7 people who had over 5 publications didn't match, and 8 people who had none didn't match. So I think this just speaks to that you should do what you're passionate about and what you're good at, and not just try to get an abstract for an abstract's sake. This sort of makes sense. Okay, and then here's like the data for like work experiences and service experiences, where the data is sort of similar. And then this just shows how many % people matched and didn't match were AOA, graduated from the top 40 NIH funded schools, have a PhD or other graduate degrees. Now, ERAS now has like a geographic preference section. And I've gotten questions from students over the past year or so. It's like, hey, should I put, I don't care? Should I put my preference in? I was wondering what Doctors House and Tillman, what do you guys feel about the geographic preference section, and how do you guys advise your students?
I mean, I think if they have a geographic preference, I think you put it in there because I get questions from students like, hey, I might be interested to go to, I've got my significant other has family in California. My family's in Boston. And again, they're going to medical school in the Midwest. Do they need to do a third away rotate or a third EM rotation so that way they're hitting both coasts? How do I let these places where maybe I didn't rotate at or didn't go west of the Mississippi, how do I let them know? And I think the geographic preferencing is one of those. I've not seen the data to say are people being offered interviews because of geographic preference signaling versus not. I think we'll get a little more of that information over the next year or so, but it's one of those things I don't think there's a reason not to. I don't know if it really helps though, but that's what I'm telling my students is don't do another away rotation if you do well. But again, this would be a way because it does give you a little bit of a chance to put a little bit of a narrative like I'm interested in this location because of X, Y, and Z.
Yeah, the 2 options are for you to mark out your geographic preferences, which you have 3 regions you can choose, or you can choose to say that you don't have a geographic preference and and the incremental impact that's going to have on a residency application review team is probably pretty small, especially if you can through your interview or through the rest of your narrative convey you're going to be a good sport no matter where you end up.
And the next step, I would like to get Dr. Tillman and House's opinion on preference signaling, because that's like a newer addition to the ERAS fund. Dr. Tillman, you want to go first in your thoughts?
Yes, absolutely. You have to use your preference signals for sure. One thing that I want you to do is when you do your away rotation, make sure you get a very clear answer from your away rotation whether or not they want you to use your preference signal there. Sometimes places do, sometimes they don't. Same thing with your home rotation. They should tell you very clearly whether they want you to use it there or not. There's a design, it was designed so that you would use it at your home and your away, but it doesn't have to get used that way. And then my students often ask me, should they spend their preference signals on places they really want to go that are aspirational only, or save some places that they don't as much want to go that are more kind of in the lesser competitive for them cohort? To which I say there's no clear data as to which one is important. And I tell them all your preference signals to places that you'd be excited to interview.
Do you have any comments?
No, I kind of talked to the students about kind of similar where should they all be the top programs? There's probably some gamesmanship that maybe do a mixture, but like you said, these should all be programs that you really want to go to and you're excited about. Or from some of the other specialties, there's definitely data that says you do increase your chances of interviewing at places if you have signaled them. Now, if you don't signal a program, they don't necessarily know if did you signal no program and you just not signal that one program. So going to places that you are really interested in, because again, you also don't want to kind of list maybe programs. I'm going to list this one or I'm going to signal this one because it's probably a less competitive program. It's probably okay. Maybe I'm more likely to get there. But again, if you get offered a spot, then you're potentially taking it away from someone else who might really be interested in that program and really want to go there. So kind of using it in that way. I think talking to like your home program and away rotation, people I've talked to, most people say, yes, you should be signaling both. But again, there may be some programs that said, no, you don't need to. You rotated with us, so we know you're interested in us. I think by default, unless you get a definite no, don't signal us, I would signal them. Because even our PD said last year for our own students who didn't signal, did they not signal because they really didn't want to come here? Because I do know there are some students that didn't want to come here for residency for various reasons. Or did they not signal us because they didn't know they should have signaled us, kind of thing.
Yeah, I agree with them. There's a little bit of gamesmanship. There's one early study in one of the pilots for preference signaling that just showed that the greatest benefit was to average to below average students to programs that are average, which is interesting because relatively they get less signals. So those signals mean more. But that being said, you should probably signal places that you really want to go and talk with your advisor about that. Now about SLOEs/SLOEs. Oh, sorry, Dr. Tillman, you had a question or comment?
There is some discussion about how certain hyper-competitive programs can make up their entire interview list out of just people that preference signal to them. They get enough preference signals for that, but it becomes useless for that program because they get 1,000 preference signals. They can still only interview 300 people or 200 people. It becomes a challenge there. The real big win on the program side is a program that gets 130 preference signals. And it's like, oh, perfect. We'll prioritize these 130 people, fill the rest of our 200 spots out of the non-preference signals.
Got it. Now back to SLOEs. I know I'm from Texas. We call it SLOE. I think across the country they say SLOE, but the great state of Texas, we call it a SLOE. Anyways, the SLOEs are probably one of the most important parts of your application. It's the 2013 study. The left showed that it mattered. And then the 2020 NRMP survey showed that away rotations matter most to compare it to other program directors. Just keep in mind in terms of SLOEs, pardon me, that's the copy of the old SLOE on the left. It got updated a few years back. Preferably, program PDs prefer group SLOEs, and this is done by a group of people. Lastly, like the PD, the CD, as well as the associate program directors. Also helpful, but not as helpful is the individual SLOE, which is done by individual faculty. There's a variety of different kinds of SLOE. There is the SLOE done by EM faculty at an academic EM residency, and this is by far the most highly rated and valued. There's also non-EM SLOEs that you can write. In my personal opinion, they don't really matter that much unless it's like Dr. Fauci or if I know them, because I don't really know who they are, and students only choose people that think they're pretty good. And that's like the off-service SLOE. Some specialty SLOEs are also helpful, but to me, to be honest, it doesn't sway my opinion of the student too much as you choose people that like you. Anyways, Drs. House and Tillman, any thoughts on SLOEs?
As you're selecting your away rotation or your home rotation, there are a varying type of rotations. Some places might have an ultrasound rotation or global health rotation or whatever, and they can generate a letter from that, but it really has to be an advanced fourth year type of emergency medicine elective that will generate the group SLOE or group SLOE. That's that's the away rotation that you really want to do. That's one that you have to do. You're welcome to do an additional subspecialty rotation if you have the space and schedule for that, et cetera, but that's not going to provide the letter you want.
Yeah, so like the ultrasound one or the global health one, that what you might be asking for that subspecialty SLOE. For core EM rotation or clinical EM rotation, that should be asking for the SLOE. So definitely plan on every single one of your clinical EM rotations that you're going to ask for a SLOE and the SLOE. So that's the thing is if you end up doing 5 rotations, 1 home and 4 away, you need to be asking letters from all those places because that actually can, again, look potentially negative if you've done an EM rotation and don't have a letter from there. So you want to make sure and ask for letters from all those. Now, again, the SLOE, the off-service faculty. So again, that would, hey, I had a great sub-I on medicine and I'm going to ask them for a letter. But I usually tell my students is you can ask them to put it in that format. Some faculty are like, yep, no problem. I can do that, especially since there's more and more programs that are going to like a SLOE type format. Then there's other faculty who are like, oh, I like the traditional letter. I'm just going to write that. And that's fine as well. I think when we looked at some of the prelim data about the SLOE, we're trying to again mirror it with the SLOE. Maybe it didn't have that impact as much as what the original intent or hope was with it. But I just want to make sure people know if every clinical EM rotation that you're doing, and by clinical, again, I mean, you're in the emergency department, you're seeing patients. This isn't the ultrasound, this isn't the research one or whatever. You're going to get that SLOE. Because again, that would be one of those where you may have a program who doesn't offer an interview because they're waiting for that letter. So again, you want to make sure that you're getting those letters.
I agree with Dr. House. Like it's a red flag in the application if you rotated somewhere and you don't have their SLOE. That makes me think, why didn't that student do it? Did he or she not perform as well? Now, here's some tips for your rotation and how to do well on your rotation. First off, read before you start the rotation. This is like usually an audition rotation. So some things that our students use, I think everybody uses Rosh Review to try to prepare for the EM clerkship. For podcasts, EM Basics, pretty common. I'm old, I read books, it's EM Secrets, but I feel like that's fallen out of favor with the modern medical student. For your shift, show up early, leave late. We love it when students take ownership of their patients. So please follow up your patients. We value that more than seeing a lot of patients. At the end of the day, you want the team to be happy that you're there. Dr. Tillman in house, any comments you guys want to add to this?
I was just going to respond real quick to one of the questions in the chat because they asked about a PTM elective. Does that count? Do you get an SLOE or no SLOE? I think it kind of depends on the rotation. So that's to say if your pediatric experience is housed under pediatric, then I'd say I probably would do the off service, where if it's housed under the emergency medicine department, then you could ask for an SLOE. Like I say, I think it just depends on the type of rotation in regards to what you're getting. I do think that you can use that as another way of getting into a program and getting to know that program. In regards for the tips for rotation, I agree completely. And I think that probably just as important about taking ownership is actually kind of talk with whoever you're working with in that shift. I talk to my faculty and my residents about this on a yearly basis, but just making sure that your goals for that shift, your expectations for that shift are in alignment with especially if you're doing a away rotation where you don't necessarily know the culture, with the culture of that department. And what I mean is I've actually had one faculty member email me every time a student picked up a patient without talking to them first. And that was for whatever reason, that's that thing that got them upset and annoyed, but everybody else expected it. Just pick up the next patient and go see them and let me know about them. So I think just really, like I said, getting an idea of what the culture is at that program. So you're doing what's expected. Again, kind of like you said, you want to make the team happy. You want to be, when I'm reviewing evaluations for our students, you want to be that one that said, oh, they helped so much. They made my job so much easier. They were great. I'd love to work with them again. You don't want that one that said, hey, they presented a patient. I don't know where they went to after that. Or what I've gotten, the students I have rotating now are mostly those that are graduating a couple of months, asking to leave early, things like that. You don't want those in a village. You want the ones that are making their lives easier, trainee or residents and faculty's lives easier, adding to the team, being helpful. Again, not that you should be doing scut work. You shouldn't be doing that, but being an asset to the team.
I usually tell my students that emergency medicine, in addition to being the resuscitation specialists, we're also communication specialists, right? We communicate with new people that we've never met before all day, every day. We convey urgency to consultants. We ask for help from dozens of variety of different specialists. And you should, on your shift, demonstrate that you are an excellent communicator, that the nurses can talk to you, can come up to you, and you are approachable, that you are teachable and enthusiastic. So much more about your SLOE and your evaluations in the department will be based on your attitude and your willingness to dive in and just be helpful, more so than your knowledge. If you come in and you're not teachable, but you know a lot of things already as a student, I would rather work with somebody who knows less and is teachable, because that's what residency is for. I can teach you in residency.
All right, that finished my slides. Is it time for questions?
If anybody has any questions, put those in the chat. If you could put those in the chat. I do have a list as well if nobody has any questions of some common questions. So does anybody have any questions before I ask questions? First one here. What would you say is the most important in determining your competitiveness as an applicant outside of your SLOEs, clerkship grades, or step 2, others? So outside of SLOEs, what are your next most important thing in terms of competitiveness?
Great question. The NRM PPD survey is worthwhile looking at. That's an enormity survey worthwhile looking at, but basically the typical answer is MSPE. And specifically for your medical school performance evaluation, what these are looking for is lack of red flags. Dave had to repeat 3 or 4 years, now failed these courses because of his attitude, or is forced to remediate in some specific way on that kind of thing. And then everything else is a substantial level down. Like the rest of the application is so much less important.
But I will say, I mean, different programs are going to kind of focus on different areas. You know, I think Navdeep kind of brought it up earlier that most programs are doing a more holistic review. So it's not so much so if you don't meet this, again, maybe I'm naive, but hey, if you don't meet the step 2 score, I'm not even going to look at your application. There definitely was a lot of that prior to people kind of changing their review. So again, I think that's changed a lot. So if you go to, again, University of Michigan, there may be a little bit more weight put on the research you've done. Where if you went to residency, where I went to residency at, it's going to be more like your volunteer, your leadership stuff. So again, they're going to put a little more weight on that when it comes to your application. But definitely, if someone reviews your dean's letter or whatever we're calling it now, and there is red flags, then again, that's going to be a potential concern.
The next question we have on here is, do we know how many signals we will have this year?
So for this application cycle, it was 7 signals. I think for next year application, I don't know if we know really at this point, because again, some of the data with how much even the 7 signals impacted has not been gathered yet. There's a lot of discussions behind the scenes on what do we do? Do we look at changing the number of signals in regards to try to limit over application, all these other things that can complicate it? I don't know if for the 2025 application cycle, if it's going to be 7, is it going to be 50? I don't know.
And the next question, how much weight do you put on what program the SLOE comes from versus the content of the SLOE?
It definitely matters a little bit. The good thing about the SLOE is that I don't know if you guys saw the second slides, but the SLOE requires or automatically puts in what percentage of people who were evaluated last year got top 10 or top third or middle third or bottom third. So it's easy for people to see the relative amount of grade inflation at an individual site right in the SLOE. That's important to know. And then there are some sites that are known to be competitive and have the very best across the country go into these away rotations, try to cut their teeth and show their mettle. And a middle of the road SLOE there versus a rotation that is less competitive might be a higher weight.
I think it's tough to know from the student perspective because there is so much that kind of goes into it. If you're at a program where it's pass fail, again, depending on the residency site, they're going to look at, they may or may not look at that differently compared to a program where it's honors, high pass. They may look at the program. If you're honors, high pass, 99% of people get honors and 1% get pass and no one gets high pass. Again, there's going to be those caveats and that sort of thing. So there's some importance to it, but at the same time, it's variable. It's tough to kind of say, yes, you need to do it at the most competitive places. Because again, the most competitive places may not actually be the right spot for you. So then I'd put more weight into that for as a personal, where I don't want to go to a research heavy place, then don't do your away rotation there. We got to say Michigan, since that's where I'm at, University of Michigan. You go to a place where, hey, I want a counting experience, go to a counting program because I'm at an academic place. Or, hey, I'm more interested in community medicine, then you should be looking at a program that might be more of a community type site. So there is some importance to it, but I think it's what's best for you.
Next question, what is the best way to go about asking for a SLOE? And should we ask for feedback throughout our rotation to make sure we're on the right track for earning a good evaluation?
To be honest, every away, I think the clerkship director is expecting to write a SLOE. I know when I run my clerkship with my away, I expect every student to send me a SLOE. And if they don't, I'll send an email asking to write their SLOE. And I think that's how most programs are, because you're making all the time to go out there. They want to write your SLOE. I wonder what Drs. House and Tillman feel about it.
Yeah, it should be an automatic thing. If you're coming to a program that writes group SLOEs, I'm going to tell you during orientation, we are going to have a write you a SLOE at the end of this. And we're going to meet at the beginning of your second week, talk about how things are going. And we're going to meet at the end of your fourth week, talk about how things went. And you're going to know from me a really good handle of what your SLOE will look like and what it'll mean.
I tell students when they're going on aways, kind of like that Tillman was saying, you can even initiate, talk to the clerkship director. You try to meet with the clerkship director early on. So you can kind of ask exactly that. Because I have one, so my students for their rotations can actually rotate at 4 different sites. One of the sites, they do a quote unquote group SLOE, but they want you to pick out that one individual to kind of be the primary author. And then it goes to the site director there. there and they kind of look at your performance, that letter, and then kind of put it in context of everybody there. So I think it's really important to kind of have that sit down, or at least meet with the clerkship director or someone who to say, hey, how do you guys do this? What do you want from me? And like I said, if I have a visiting student, I'm going to expect that they're going to want a SLOE from me, but I also have met with them already and talked to them about our process for how we write SLOEs. In regards to how you're doing, I mean, hopefully you guys are getting feedback throughout the rotation. So you know what areas you need to improve on, and you know that different programs are better at providing that than some others are. But I think it's meeting and saying, if you're coming to email me, if you're coming to even the week before, hey, I'd love to get a chance to meet. I'm coming from a rotation next week. I'd love to get a chance to just talk about letters. The other thing is you do get that overall, which is sometimes hard from orientation. What is that culture? Is it where I'm only working with residents, like one of my sites, or am I only working with attending, which I know some other sites have that. So I think try to meet with the director or whoever's kind of running that rotation early on to get an idea. Thank you, Dr. Tillman. I see you waving by. Enjoy your shift.
And it looks like we got an answer to our last question here, which was how do you recommend going about researching and finding different away programs, especially when researching different types of programs? And Dr. Tillman answered, start with SAM or EMER match to review programs. I don't know if anybody else has any other comments on that.
So I just say we're kind of getting close on time. Say if you got a clerkship director, talk to them, because again, they usually can tell you what previous students have experienced, what have been great, which have not been great. Again, I had one student who said this was my top spot. I went and rotated there and it was terrible, and now I don't even want to interview there. So that'd be good to know again what the experience with previous students are too, is another way to look.
I think we have time for maybe one more question. Does anybody have any last second pressing questions? Looks like we're almost up on time here. Give it like another minute here, see if anybody has any other questions. All right, well, Dr. Seacon and Dr. House, and of course, Dr. Tillman, who left, thank you guys so much. Do you have any last second words of wisdom for our applicants before we head out? Someone said our interview is going to be online or inside. I think they mean in person. And I think that may have been answered in the chat above that. I guess was that there'd be about 8% virtual. Dr. Tillman answers a couple of minutes ago. Likely a few more programs will move to in person, as a couple had this year, but overall I'd estimate greater than 80% virtual. Oh, in there. All right. Well, thank you guys so much. Any final words of wisdom before we head off?
Since I cut you off last time, Andy, I'll let you go ahead.
Oh, you're good. No, like, to be honest, like, emergency medicine is a great field. Like, I'm really excited that you're all into it. I know it's a stressful journey, but don't worry. Most people want to go in EM, matching in EM. You guys will all do just fine. The most important thing I would say is find yourself a good mentor, one of your own institution. I think SAM has a mentorship program as well. You use that program to find somebody, offer you mentorship, offer you guidance, and make sure they're honest. That's by far the most important thing.
I was going to mention mentorship, so you already stole my thunder, so I got nothing else to add.
Thank you guys again so much.